Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
Okay, we want to reduce the readmission rates. How do we reduce the readmission rates? Let me share that with you guys. This is what my agencies do, right? Agencies I actually own and operate, and the agencies that I work with, we tell them this is something you should have. We do what we call a medication reminder program. Now remember, for home health agencies, it's not always that we have a staff member with the patient. We're only visiting the patients 1 to 2 times a week, and we're only there for like an hour. For non-medical home care people, it's rarely that you have 24-hour care. You might have 8 hours, 6 hours, or 4-hour care. So by offering a medication reminder program where we set it up where we call the patient at 9 o'clock and at 5 o'clock every day to remind them to take their medications. Now, is it going to help always? No, it's not. But it's a differentiator, and it does help a little bit for the reminders. If you have an agency right now, do you guys call your patients every day to remind them to take their medications? More likely not. And so we do that ourselves, and now a lot of the companies that work with our consulting company does that themselves. Now the cost is literally $10 a patient a month. Once again, $10 a patient a month. That's a pretty good price. If you had 100 patients, just imagine 100 patients, and you have to call them twice a day. If it's about 5 minutes to make each one of the phone calls, that means you're going to be spending about 1,000 minutes calling people to remind them to take their medication. And you're not going to be able to call 100 people within an hour to remind them to take their medication. So this is a service that we actually provide. If you don't want our services, hey, I'm sure there's services out there that can do it for you, but a little bit more expensive. We charge $10 to call a patient twice a day to remind them to take their medications. Now that right there, my friend, is an amazing thing. So think about that. What can you do to make yourself stand out? Once again, communication with the team, with the patients, the family members, but also communication with whom? With the facility as well is important. This allows us to be able to provide better care. Amazing. Think about it. What can you guys do at this very moment? So we want to be able to have that communication. Bad care is a no-no nowadays. Our patients, what's going to happen to our patients? They're going to get what we call a medication reminder program, right? We said that. But another thing that they get is what? Is an emergency call button. You guys seen this all, right? You guys probably seen those commercials where somebody presses it because they say, help, I've fallen, I can't get up in the tub. And so these little devices, whether it's going to be in your wrist or whether it's going to be in your necklace or whatever it is, or a little clip-on, right? So we're willing to spend $30 for these type of items. It costs us between $30 to $50 for this machine, but we're paying $20 a month for the services. Now you're going to say, well, Michael, that's $20 a month for the patient. But here's the thing, guys. Right there alone, we're providing additional safety for the patient. Number one, it does GPS tracking if we want to. Number two, if the patient gets in trouble, they are able to press the button and call 911 that way. Number one, it gives them the sense of security. Number two is we're the main contact when those buttons gets called. The 911 operator gets called, but the company also notifies us as the contact, so we know something's going on with the patient, because maybe we can address it right away rather than having 911 called automatically. So there's a variety of different things that you guys can do, all right? Just think about that. That's how you provide better care. That's how you provide care that's different among the rest. Part of bad care is not giving the right amount of education to the people. Because if they don't know about the diagnosis, they don't know how to care for each other, whether it's the family member or the patient itself, that's what causes problems. Most agencies think that, oh, let me give them a little flyer about diabetes. Let me give the patient's family a flyer about COPD. No. Some people are not able to read those things correctly. So to be able to go through that is we provide video education as well, and that's available for them, provides better care. Once again, do you know another agency that provides education through videos? Does your agency provide that? But guess what? When we're talking and presenting our services, they're going to see that, wow, this is what makes you guys stand out. Yes, it does.
Brought to you by our partners at homecareansweringservice.com, and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.